we're here for the accreditation session with RIFCA. First, I want to start by doing acknowledgement of country. So the Northwestern Melbourne PHN would like to acknowledge the traditional custodians of the land on which our work takes place, the Wurundjeri Woiwurrung people, the Boonwurrung people, and the Wathaurong people. We pay respects to elders past, present, and emerging, as well as pay respects to any Aboriginal and Torres Strait Islander people in our session with us today. So just some housekeeping before we start. So you will all be muted for this meeting. We have a Q&A function set up for you and the chat. So please feel free to post any questions or any comments in those two boxes. The session as well will be recorded. So you'll receive a link with the recording and a copy of the slides after this session. And your questions will be anonymous to protect your privacy. And just an important note here as well, for your CPD points, we're using the Zoom participant list to mark attendance. So please make sure that the name that you have against your name on Zoom matches what you have registered with. If not, please go ahead and change that one, or you can also send a message to Laura, my colleague at Northwest Melbourne PHN Education. Just there, there's a little message function just to identify yourself as well. Firstly, thank you. I would also like to welcome Rivka to this meeting. We're really lucky to have Rivka here with us. Rivka has began her career as a medical scientist, successfully managing a regional laboratory for a major pathology provider before shifting to a career in general practice management and accreditation. She has an extensive experience managing several medical centres and has a strong interest in quality improvement, governance, business planning, and financial management. As the Director of Medical Business Services, Rivka offers consulting, coaching, and training to the health sector nationally. You may also know Rivka as the founder and administrator of the influential Facebook group Practice Managers Network. It's really great to have Rivka here with us today online. She has a wealth of knowledge, and I really encourage you to take the opportunity to ask as many questions as you can. That's the true benefit of having these live sessions. So please, I really encourage you to take this opportunity, and we would love it if you pop in any initial questions you might have about accreditation. Perhaps it's something that you've never been able to find a good answer for, or maybe there's an area, a specific area in accreditation that you're unsure about and you'd like Rivka to discuss. So yeah, please use the QA function as much as you can, as much as you would like. We really encourage you to use this session to your benefit and make it as interactive as possible. So welcome, Rivka. We'll let you take it away.
Thank you so much, Abigail, and well done on, a really thorough introduction there. As always, it's really lovely to be with you today, which is World Patient Safety Day. I don't know whether anybody has realised that, but I thought, oh my gosh, as we're starting to talk further about accreditation, we need to acknowledge that, yeah, patient safety is the focus for today. So, look, as always, it's lovely to be with you. I also would like to acknowledge the traditional custodians of the lands on which we are meeting. I am located in Dja Dja Wurrung country in the Macedon Ranges, so not too far away from you all. There may be a few attendees today who also came to the session just a little while ago on the accreditation basics. As I sort of said with that earlier session as well, we are certainly not covering off every standard of the RACGP standards, in these two sessions. We're taking particular deep dives here. But today's focus is going to step us a little bit beyond what the accreditation requirements specify of us. So this is, I guess, the stretch session where I would like you to think about where you're performing well and where you've got your eye on the horizon for, what you're going to be focusing on next. So, whether it is about extending your patient services or improving your staff management systems, there are, well, pretty much every area in the accreditation standards in which you can kind of go, rightio, where do we step to next once we've met the basic accreditation requirements? So that's kind of the focus for today. So we're going to just have a very quick recap of the accreditation system, just to refresh your memory and get the neurons firing at this lunchtime on the Tuesday. And then we're going to do a deep dive into two key areas, and that's around your business systems and in particular business planning and clinical governance. And I know that that term kind of strikes a little bit of fear into many practice staff that I come across, that firstly the word governance is a little bit formal and a little bit scary, and then we add clinical to it and we can feel a little bit overwhelmed. So hopefully you'll get a better sense of what clinical governance is all about. So let's come back to the why around accreditation. And look, we know, especially at this point in time where there are going to be quite significant changes coming up to the Medicare funding system, and I'm specifically referring to the My Medicare system, which is going to have a big impact in the way that you're going to be running your chronic disease management services within your practice. All of these changes to which significant dollars are tied are going to be more and more linked to be eligible only for practices who are accredited. So again, the My Medicare system changes coming through. You can't enroll into that system unless you are accredited. So we've got some pretty compelling reasons as to why we want to do that. But it's much broader than just being able to intersect with the Medicare item numbers and, tapping into the practice incentives program and the like, which is sort of that bottom check mark that you can see on the screen here around practice incentives program and workforce incentives program. If we kind of cover off the major areas of, well, why is this actually really, really important? And I think for me, it's around, those top areas there, the provision and improvement of quality care. So we need to focus on the safety and the quality of the clinical services that we deliver, because they are high risk in nature. If we get it wrong, we can do real harm to patients, and we want to avoid that. So the overarching theme around accreditation is harm reduction, patient safety, quality indicators for the delivery of high quality care. That's really what accreditation is all about. So beyond the dollars, why would you not want to ensure that when your business is based on clinical services, that you're not doing everything within your power to ensure that safety and quality? It is so much at the heart of what you do, what you should be doing day in, day out. So this is your framework, right, for getting that right. Once you've undergone that process, there is the quality recognition. You will get the certification that goes along with that, which is a signal to the public that your services are safe, they are high quality, and that you've got good systems and processes in place. More so that you regularly review and audit how you do what you do, and it then becomes that sort of benchmark system for measuring how you're performing against other healthcare entities as well. So that's kind of at the heart of what accreditation is all about. And if you missed the earlier accreditation basics session, then you may not have seen this particular graphic, which is the structure of the standards sitting around a pie sliced into three neat pieces, which comprise the three modules that make up the RACGP Standards for General Practices: the core module, the quality improvement module, and the general practice module. So let's step into what sits within each of those pie slices. In the core module, we have 8 standards, and they are around communication and patient participation, the rights and needs of patients, practice governance and management, and we're going to spend a fair bit of time talking about that particular standard and its meaning, health promotion and preventive activities, clinical management of health issues, information management, and the content of patient health records. And finally, the last standard in the core module is education and training of non-clinical staff. In the second pie slice, the green one, the quality improvement module, there are 3 standards. The first one is called quality improvement. The second one is clinical indicators, and the third is clinical risk management. And then finally, we've got the general practice module, 6 standards in there, and we've got access to care, comprehensive care, qualifications of the clinical team, reducing the risk of infection, so infection prevention and control, the medical practice, and vaccine management. So those are the standards summarised. Abigail, you're back.
Hi, I'm back. I have a question. I think
Go
this
for
might
it.
be the best time to ask it.
Absolutely, anytime, I welcome it.
So I just have a question that says, what are the significant changes within infection control? So with infection control, in particular, processing sterilized instruments.
Okay, it's a great question. I'm presuming you missed the last session, which was accreditation basics, which delved into the reducing the risk of infection and the changes to the standards. So I'm going to deflect and not do a deep dive into that because time won't allow me to do that. However, the recording of the first session should now be available. So I would recommend that you register and just view the recording of that. And I'm presuming all of your questions will be answered in there. Was there anything else, Abigail?
No, that's it. And I'll add a little note there as well. I can send through that information as well.
Yeah, fantastic.
Yeah, I can
Excellent.
send a link to it. Yeah.
Terrific. Thank you.
Bye.
Okay. So, yeah, no, that's great. All right. So just another brief recap on how compliance can be demonstrated when your surveyors come to visit your practice. So we are focusing on the outcomes, and by that we mean that we focus very much on what the patient receives rather than what the practice provides. So the focus is very much on the patient, patient-centered care, patient-centered services. The compliance is informed by 3 key methodologies: interviews, document reviews, and observations. So the surveyors, on the day of your survey visit, they will interview staff. They will look at all of your documentation and especially your policies, procedures, and records. And they will see and observe what's happening around them. So you will know that the surveyors and your surveying company expect your practice to be open and operating on the day of the survey visit. And that is so that they can actually observe the business as it's actually providing its services rather than closing your doors for a day and saying, well, we're going to do accreditation now. So they want to see your business in action, and they'll be looking at your building and everything in and around all of that. Now, we do know, and again, I'm just touching back on the earlier accreditation basics session, there is a great deal of flexibility on how you demonstrate your compliance. And you need to consider what works for your practice, what's fair and reasonable, what would indicate that you have understood the intent of the standard, so the reason behind the requirements, and that you're able to demonstrate that. And it's on that flexibility of how question where you can really start to elevate your performance as well. So I'd be encouraging you to think about not necessarily meeting the baseline standards requirements, even though, of course, that's what you're going to be ultimately judged on, but to see how and where you could possibly extend your performance and continue to improve the quality of what you do and how you do it. And so, again, we're just going to give you a couple of examples in which you might be able to do that. So we're really talking about going beyond the tick box exercise. We know that when you go through and you do your self-assessment, that's kind of what it feels like, right? It is a bit of a tick box exercise. Have we got this policy or procedure in place? Do we have these records available? Do we have certain elements of requirements available within our practice? Do our staff know what they need to do? So what we're really challenging you to start thinking about is really embedding all of these standards, requirements and activities into your everyday practice. And you will know when you start to really achieve that, because then the 3-year exercise of coming up to accreditation is going to feel a whole lot less stressful than perhaps what it does when you feel that you might be unprepared for accreditation, or you've just not looked at the standards for a long time, or even if it's your first time around, if you've not had too much experience with the accreditation system. The first time feels a little bit challenging because it's all reasonably new, but the more you can continue to lean into the standards and what it asks of you and continue to build on it, the less work you take away from that 3-year activity, and the more you will absolutely be embodying that quality improvement and safety and low risk environment that we are seeking to achieve. So it's about reducing risk, which is going to be protective for your practice. Of course, we're trying to avoid all of those adverse events and unforeseen circumstances from taking place, especially where it concerns the services that we deliver to patients. And what I would challenge you with as well is that in order to do that, it's going to really test the leadership and culture of excellence within the practice. And that's easier said than done. So who are the key leaders within your practice? What is their mindset and their values around that notion of continuous quality improvement? Do we start having staff meetings because we've got accreditation coming up and we need some evidence that we do this? Or do you have staff meetings because it's a really great way to keep your team together, informed, listening to feedback and improving your services and how you do what you do along the way? So it's just one example where that real sort of living of the accreditation standards is different to the tick box exercise that sometimes accreditation can become. I would also challenge you to think about perhaps the marketing advantage that you will gain when you truly live the quality metrics of the accreditation standards. You're truly going to be shining over and above perhaps your competitors within, you know, your suburbs and in your environments, if you truly are focused on all of these elements and going to the next step and beyond. But you, of course, have to think too about what are the resources that you might need to achieve that. It might sound like a lofty goal, right? We're going to continue to expand out our quality of services, etc., but we're already feeling like we're really, really pressured. You might have a high degree of staff turnover, which makes the achievement of some of these sort of extended accreditation standards perhaps more ambitious than achievable. But you want to be thinking about, well, what can we do here and now within our practice to start living those values, and then perhaps looking at how could that possibly influence our staff turnover, our doctor turnover, all of the challenges that we face within our practices. How could that sort of, you know, high leadership and great culture approach actually protect us from some of the waves that we find ourselves in? So I'm going to challenge you to find some structure within the chaos of what can often be the experience, especially of practice managers, right? That's the world that I've resided in as well. And every day can feel like an ocean of unknowns and things coming at you, and a very reactive workspace that you work in, with everybody's demands sort of, you know, falling in your lap, and having to respond quickly to those in order to remediate, to troubleshoot, to set right, to respond to the many changes that keep kind of coming our way. So we need to think about finding really good systems to help us navigate around that, so that as the practice managers, you can continue to focus on the bigger picture items as well, which can get lost in the crazy busyness of the everyday experience. So that's where your thinking and your systems and your structures may need to land in order to give you the space and the framework for being able to deliver to the next level of capability within your practice. So some of the things that I'm talking about here are areas where the accreditation standards don't speak to quite so strongly as what they might. The image in front of you here is around what I kind of call the practice management pie, and it sort of structures all of the activities and accountabilities and focus areas for our practice management function into 4 key domains around planning, people and culture, systems and processes, and quality and risk, with some sort of headlines underneath each of those areas around what we need to do in order to manage our practice. And you'll see the bulk of them, when you think about those, they are spoken about in the RACGP standards: staffing, HR, performance management, communication, patient care and services. That's all bread and butter stuff as far as the RACGP standards are concerned. However, there are other areas that I think are really important for the success of your business that the RACGP standards don't even touch on. They are not interested in. And that is around your financial success, your financial strategies, your key performance indicators. What is it that you measure and tell you, how you're going to improve? And I guess we're really talking about business metrics here, not so much patient and clinically related metrics, because you certainly are required to touch on those as far as the accreditation framework is concerned. Innovation is kind of a good one that we think about, how can we systematically keep improving what we are doing? What are some of the new technologies that are coming along that are going to either hamper or help us do a better job? And then I guess lastly, marketing and promotion. How do your patients, how does your clientele know about your services and all the great work that you do? How do you promote yourself? Where do you promote yourself? All of these things are not covered by the RACGP standards. So when we consider improving your business systems, the sorts of things that we're talking about there are documenting processes that are understood and adhered to. So going beyond the policy and procedure manual that is mandated through the RACGP standards, extending that out into things like work guides and ways of communicating the expectations of all of your staff and your team members, and making sure that they all understand what is required of them, and then more so that they adhere to them. You're going to end up singing from the same songbook, which means it's much more likely that you're going to end up in a position of success rather than chaos. If you've been to any of my sessions before, you will know that I'm an absolute lover of short form spreadsheets and streamlining your activities wherever possible, because we need to simplify our work. We don't need to complicate it further. So when you're kind of thinking about, well, okay, look, that's really great, where we're talking about work forms and guides and more policies and more procedures, more pages in a book, I'm saying, no. We need dot points. We need spreadsheets to capture ideas and thoughts rather than essays and additional words. So I'm actually talking about simplification rather than complication. There are a number of commercial products that will help you do these things as well. And I won't sort of deep dive too much into any of those, but there are tools that are going to make these sorts of things much easier for you. You want to make sure that you track important actions, due dates, and risks. You want to make sure that as a practice manager, you have your eye on the prize in terms of what's coming up. What do I need to know about? What do I need to plan for? An example of that might be making sure that you've got mapped out in your schedule somewhere and somehow the dates or the times of the year where you are reviewing your, your practice fees, or where you're reviewing your practice risks, that you've got a really systematic way of working through all these things. Nothing's going to fall between the cracks. So if you've got like a scaffolding around that, something that is other than just what you've got in your brain going, oh, I need to look at this next month, where you've got that mapped out, you kind of create a little bit of a Bible of what do I do and when do I do it. That gives you a little bit of that cognitive load back to allow you to focus on the actual doing bit rather than remembering what it is that you still need to get done. As far as practice management education and upskilling is concerned, make sure that you keep focusing on continuous learning as a practice leader and as a manager, that you are always in that space of curiosity, learning, identifying your own skills gaps. What do you need to beef up on in order to better affect your leadership skills, to become a better practice manager, to fill those voids that are making perhaps your job sometimes stressful and difficult because there are skills gaps that would be really helpful for you to overcome. So work on a learning plan for yourself, of course, for your staff as well. Tap into both formal and informal education. I'm a great proponent of podcasts. I love listening to podcasts while I'm out walking the dog or doing other chores. I'm a voracious reader and always on the lookout of what's new, what do I need to have my head around. So again, just that notion of curiosity around what's out there, what else do I need to know? That's a mindset more than a particular skill that you need to acquire, but you've got to hone that at every step of the way. I really also love the notion of a team skills matrix to help you map out not only your own goals and learning needs, but that of your entire team as well. If you've got your finger on the pulse of which staff members bring which skills and expertise and strengths to the team, and where are their skills gaps? If you can map that out, spreadsheet's a great way to do that, then you can far more easily identify what training you might like to send your staff on, or what you need to recruit to when you are looking for new staff as well. So a skills matrix can be a really good way of having good visibility on where your team is at and where the skills gaps might be. I also love the idea around time blocking. And that is, again, for practice managers, but certainly nurses as well, an important aspect of creating the time and the space to do the deeper thinking and some of that deeper planning and the deeper work that needs to get done if you're going to elevate your performance in all of these areas that the RACGP standards speak to and beyond, right? It's not going to happen by itself because your day's busy. And if your door is always open and never closed, you will always be interrupted with the day-to-day stuff that's going to keep rolling on. So where in your calendar can you block off some time? It might be an hour or two a week, uninterrupted, where the instruction will be no interruptions now because I'm focusing on the deeper work. I could probably talk for a couple of hours just on that topic alone, but if you've not considered blocking off time within your calendar before and taking the time that you need to focus on this deeper work, then you're not going to be able to step into this space of elevated performance. It is as simple as that. You've got to create the time for it. Otherwise, you will continue to get overrun by the day-to-day busyness. Now, I know too, and I've certainly seen this plenty of times in my travels, that there can be a seduction about our day-to-day crazy busyness, right? The paddling under the water, the duck's feet pedaling really, really fast. You will, at the end of the day, absolutely get a great sense that you've worked really hard because you have worked really, really hard. But have you worked on the right elements? Have you had some time to pull away from that crazy busyness to do the forward looking and the forward planning? And that's what the time blocking is going to allow you to get done. Delegation is also really key in all of this. You want to ensure that the right person within your team does the right task. So think about what's on your plate. And again, I'm speaking from the practice management perspective. And what could be shared amongst the team? Are you the right person or the only person who could do a certain task? Or are there others within the team who could either help you with that or do that for you instead? So all of these ideas and themes are really then underpinned by the organizational culture, the communication, the leadership, and the practice management readiness to look more closely at what keeps me busy on a day-to-day basis, and am I focusing on the right areas when I'm doing that? All right, so that was sort of the bigger picture of elevating your performance within your practice away from the core RACGP standards and I guess compliance there. So what I want to do now is take you into two areas of the RACGP standards to give you more of a flavour of what does elevated performance look like, or what could it look like. And for that, we're going to look at core standard number 3 around practice governance and management. In criterion C 3.1, business operation systems, you'll see that there are 4 indicators listed there, A, B, C, and D. We're going to look at the first 2 around practice planning and setting goals aimed at improving our services. And then indicator B, which you can see doesn't have the little red flag next to it. So it's not mandatory as far as accreditation is concerned, but highly desirable if you want to elevate your performance. And of course, I'm going to absolutely encourage you to have a go at this, which is evaluating your progress towards achieving your goals. So let's have a closer look at that. When we think about the focus areas for a business plan, there are lots of areas that are really critical that you really will want to include to make sure that you've got a comprehensive business plan. And you'll see of the dot points listed there, the ones that have the red flag next to them, they actually speak to the RACGP standards. So around business risk and performance, disaster recovery, business continuity, that's really important to have that as part of your business planning. Communication, people, environment, patient and client services, quality and risk in big letters, because that is such a big focus for the RACGP accreditation standards and the core reason for doing this in the first place. So that gets absolute primacy there. Also access to services, privacy and confidentiality. You will want to ensure that you incorporate all of that into your business planning activities to have a reasonably solid plan. It also looks at internal systems, processes, policies and procedures to do with technology, information technology, and information management as well. So all of those areas ought to be a really big focus for your business plan. But if we're going to extend that out further, it's these last 2 areas around finance and marketing that, as far as I'm concerned, if you don't include those in your business plan, then it's not actually a business plan, it's just an accreditation plan. And what I would say is that you're going to do this for the purpose of enhancing your business, not for the purpose of accreditation. So what that might mean too is, if you are documenting financial goals and financial strategies, because the RACGP standards don't specifically ask for those, if you want to hide those away at the time of accreditation survey visit, you're absolutely entitled to do so. So you don't need to wear your heart on your sleeve. You can keep all of that information private to the practice, but don't not have it. So make sure that you do consider the financial goals and actions that you're going to be looking at over a period of time. So then we need to kind of have a look at, well, what sort of formats are we talking about when we're doing our business plan? So what we've got here down the bottom, the operational plan of what are we going to do, who's going to do it, when and how, that's really the bit that the accreditation standards actually require of you. So it could be an action plan. It could be a very simple, table of outlining what are you going to be focusing on over the next 12, 24 months period of time, around about that time. However, if you want to draw that out, if you've never done a business plan or an action plan, that's where you would start, right? That is exactly where you would land. But if you're saying, well, we actually want to get this really right, we want to do so much better with our business plan, then we can think more closely about the value of more elaborate strategic planning. And I know that the word strategic can sort of sometimes feel a little bit uncomfortable, makes us feel a little bit uncertain about what we need to be looking at and what do we need to be doing. But essentially, it is the alignment between who you are, what's important to you and your leaders, and how you're going to live those values and derive value to your customers and your clients from what you most believe in. So it kind of comes back to the heart of the why we're doing what we're doing: your mission, your vision, your value statement. Now, again, sometimes these can land a little flat because they can become, again, tick box exercises. Our mission is to provide the greatest quality care to our patients. And I kind of go, yeah, man, everybody kind of says that. What else? What really drives you? How are you different? What are you going to be delivering? So out of those sort of fundamental questions, you'll be better able to derive your high-level initiatives, the outcomes that you would like to see. How would you measure them? And what are the activities and actions that are going to be implemented as a result? This sort of strategic plan to the high level plan, which has got not a lot of detail in it, but it gives you the North Star of where your practice is headed, that could be presented in a way that's really easy to communicate with important stakeholders like your staff and perhaps your patients as well. You might like to tell them about who you are and what's important to you. Think about who your audience is, and that will help you a great deal in terms of what might it look like. So here's an example of what one of these really high-level strategic planning documents could look like. And it could be centered around culture, leadership, and succession planning. And this example practice might be looking at finance as a key pillar, services, what we're delivering to our patients. Our staff, our people are really important to us as well. And we've got some business objectives as well, with a couple of dot points of where we want to see outcomes over the next, year or however long is appropriate for your business plan. You can set out the core elements of what your mission, vision, and values are. And again, on the slide here, you'll see just an example of what that looks like. So you'll see there's not many pages, not many words on this page at all, but it is a very easy to communicate strategy plan that, if for no other reason, you would absolutely share that with your staff to let them know what's going to matter most over the next period of time, and then map out what we do from there. Then we get to the more sort of operational business plan or action plan, which is going to take those strategic pillars of where you're going to be aiming for and outline the details, the goals, the outcomes that you want to achieve, when you're going to do that. Is it going to be a recurring activity? Who's going to be responsible for that piece of the operational plan? What are the specific activities and actions that you're going to do? How are you going? How are you reviewing that? And how, where are you at now? You can then have that reflective piece in terms of the assessment. You're going to reflect on, are we getting there? Has something gotten in our way? Has it been completed, etc.? So you'll see that this is a really, again, low use of words type of business plan that's going to give you a very tangible document to help you as a practice manager and your team stay focused on what do we need to achieve and how are we going along with that. Now, at the end of today's session, you will get a QR code link where you can download this particular template at no charge. So it will just be there to get you going along the strategic thinking and the business planning guidelines. So you could, take out all of the examples that have been given here, and some of them will require updating anyhow. And you can make them exactly as you need to. You've got lots of areas where you can add in your own goals, your own strategies, your own outcomes, and work along that way. Now, if this spreadsheet looks a lot like a PDSA cycle, a plan, do, study, act cycle, it's because that's exactly what this is. There is no difference there. We're talking about exactly the same thing. And I'm just going to pause here for a moment and check in with Abigail and just see if there are any other questions or comments that have come along so far.
At the moment, all the questions have been answered. A lot of people were really interested to get a link to your previous webinar as well. So I've just popped that one in the chat at the moment, and hopefully we'll get some more questions, because this is really exciting and really interesting to see, and I guess get a plan in writing to use as a template. It's really awesome.
Oh, look, absolutely. And just look, I guess furthermore to that, what I love about this kind of structure is it's an Excel spreadsheet. And if you know a little bit about Excel, it has really great filtering functions. So what you can see on the screen here, the top example, the bottom example, the green one, that's complete. If it is an activity that has a defined start and finish line to it, once that's complete, you could use the filtering function of Excel to filter it out so that you're not seeing all the complete stuff. But as you're working through and actioning your plan, come accreditation time, you unfilter it again, and all your completed activities are still there. You haven't lost them. You've just removed them from sight so that this tool just remains really active on an ongoing basis. You're going to interact with this. You're going to review it regularly to see how are we tracking there? Are we achieving that? And that brings us back to, I guess, indicator C3.1B, which is around reviewing your action plan or your business plan. That's what you would need to do, because if all you do is start this and never look at it again, then from my perspective, you've kind of done nothing at all. So I don't know, I think a spreadsheet does all of the heavy lifting for you.
I think it's really cool, and just to have that option to filter out by urgency if you want, or remove all the things that you've done. I think it's a really great way to chunk it, because it can feel really overwhelming to tackle accreditation. There's so much
to and do. The other way to really chunk it well is to chunk it or to filter it on the who's doing bits of this. So you could perhaps look at filtering for GPs and nurses, or filtering for receptionists. And if your action plan or your business plan is pretty complete, you'll get a defined series of goals and actions for specific team members that you could then print off and give to them to say, this is where we're at and this is what we're working on, without seeing the bigger plan. So again, I mean, Excel is just the most brilliant tool for purposes like this. And again, this is what I mean when I'm talking about simplification rather than complication. So yeah, that's how that works. And
so good, so user-friendly. It's really great. And this will be sent through at the end of the presentation with our post-session email.
So what the attendees will need to do is, if you've got your phones ready, either zap the QR code, and I'll mention it to you at the end, and there is a URL string there as well. So you certainly will get a copy of the slides, so you'll be able to find that back. But if you want really quick and easy access to it, the easiest way is going to be through the QR code that I'll give at the end. So
amazing. Thank you.
That's one way to capture your operational plans there. So just kind of coming back a little bit more to the depth of what the link is between goals, planning and strategy. So again, on the left-hand side of this graphic, in the green section around the business plan, we are looking at your mission, vision, values, goals, objectives, and activities that we are going to be focusing on. And as we work through defining that, what we're really wanting to land on is that strategic differentiation. So we're moving up this arrow here. What is it that makes you different from the practice next door? Is it the services that you provide? Is it the environment that you're in? Is it the the cosmetics of your practice? Is it a beautiful practice, or does it have a very particular flavor to it? Who are you going to be attracting with the services, and who you are as a business? And, you know, where do we play? What should we be doing that we're not currently doing? And also importantly, what are we doing that we should stop doing? So these are really fundamental questions that deserve really deep attention. So it sounds like these questions are easy to answer, and I would challenge you to say they're actually quite difficult to get to the why behind what you do, and why you do what you do. So spend time on this, especially with your practice owners. And if there are practice owners here too, these are the really fundamental questions that you need to be really strong about and articulate to your team. Because if your team doesn't know what's most important to you, how will they know what to do in order to meet those goals? So it's that communication, which is so important. So team engagement, what's my role? Communicating that, and not just once, but on a continuous basis. So you really need to live those values and those missions and visions and aims. So then further along the line, we start to weave in the strategic thinking to align our everyday actions with our strategic objectives. So making sure that what we do is always aligned to what we've said is most important to us. And again, I can think of many instances where there has been misalignment there, and it might take a little while, but this is where the wheels start falling off. I'm going to give you perhaps a little anecdote of an example of a practice that I have worked with, where a GP owner, so this was a sort of, a multi GP owned practice, and one of the GP owners was very keen on developing cosmetic services, aesthetic services as part of the general practice, service offerings. And so it was decided that that was a good idea, and off they went and developed those systems with the purchase of, expensive equipment and making space available and all of the planning and implementation that comes along with a new service development. Then sometime later, the GP who was most aligned to those aesthetic services left the practice, so was no longer part of this group. And what's happened is that the remaining partners never felt particularly passionate about aesthetic services at all. So the focus on that particular aspect of their service started to suffer because there wasn't really a great interest in helping to drive that. What happened then is that it became more difficult to remain viable in that space, with more questions around, do we need to continue doing this or not? And my encouragement for the practice was to go back to your values, your mission, and your vision. What is it that you see as your practice delivering, and how is that aligned? And the recognition that there are no longer any GPs left within the practice who are really passionate about delivering this particular type of service means that they need to think very carefully about what their next steps will be. If they're not passionate about it, I'd say that's a high risk item, because it's very likely to continue to, cause harm or financial impacts on that. And so that's just like one type of example of aligning values to the work that you do and how you roll that out. So where is the passion? Where do you get out of bed at the beginning of the day? What is it that really drives you and your ownership team? And how then do you match the services to ensure it speaks strongly of that? And so what I guess I mean with all of that is that if you can align that really well, that's where the business transformation really starts to happen. And in order for that to happen, you need to continually test it and check, are our assumptions still right? Are we on track? Are we achieving what we have aimed to achieve? And if not, why not? Because there can be reasons why things go off track. And do we need to realign? What do we need to do differently? So it's a very proactive way of looking at your business and ensuring that that it stays on track. Okay, so then finally, reporting on your plan. Do that in a way that's aligned with what the requirements are for your business. So you might go from something, you know, quite informal to something more formal. I think if you start using a simple tool like the business planner that you're going to get your hands on, you could actually report on your progress exactly from that spreadsheet. So by keeping your updates within that spreadsheet and sharing that within your team, that's how you could do that. You could start perhaps some quarterly planning meetings. That might be with the practice owners, or it might be with the broader team, whatever feels right for your business. You want to ensure too that you report on the activities and the outcomes, because you want to ensure that there is an accountability to the purpose and the process of the business planning. If you are not reporting on it, then A, how do we know that we're achieving it? And how do we ensure that we continue to focus on the important activities there? So systems approach, spreadsheets, great way to do that. By reporting on your plan and reviewing it regularly, it also allows you to be really responsive to changed circumstances. And gosh, don't we find ourselves all the time in primary healthcare with changed circumstances? We've got big Medicare changes around the corner in November. We need to start thinking about our business plan and what does that mean for our business? What do we need to do differently in order to speak to that? Does it impact us at all? It may or it may not. You can respond to the warning signs and then appropriately update your strategic plan, your business plan, your operational plan. So no set and forget. This is set, create, review, revise, reflect, refine continuously, because there is no start or stop time to these types of activities. Okay, so that was a fair whack on some of the ideas around effective business planning. Now I want to do a little bit of a deeper dive into clinical governance. And what we mean by that is the system by which an organisation is controlled and operates, and the mechanisms by which it and its people are held to account. So let you just digest that for a moment. The system by which an organisation is controlled and operates. That's what governance is. And clinical governance focuses those controlling and operating mechanisms within the safety and quality improvement framework that we deliver to our patients. So the outcomes desired for a clinical governance framework is the delivery of safe and effective clinical care. And these outcomes are really embedded throughout the standards, the criteria, and the indicators of the RACGP standards. So I want to give you a little bit of an overarching framework, which has come from the National Safety and Quality Health Standards, which is the NSQHS standards. And it provides these sort of, 5 pillars of focus for a clinical governance framework. So this is the framework. The framework is around governance, leadership and culture. So the organisational leadership and culture, we spoke about that a little bit before. It is around patients' safety and quality improvement systems. It's also around clinical performance and effectiveness. So are we credentialed? Are we skilled and capable to actually deliver the care that we deliver? And is our entire environment safe for the delivery of care? And all of those 4 pillars sit around the patient because the patient is at the center of this clinical governance framework. So this is a good, easy, I guess, framework to think about and to remember. So if we map that then across from the NSQHS standards to the RACGP standards, here are the criteria that speak to those 5 pillars. So for the ones that relate to patients, it's around core standard 1, communication and patient participation, and core standard 2, the rights and needs of patients. In terms of governance, leadership and culture, that still sits within the core module around practice governance and management, which again, we've spoken about in more depth just before, and standard 6, information management. For patient safety and quality improvement systems, we're looking at a number of standards across a couple of the different modules. So core standard 7, the content of patient health records, quality improvement module standard 1, which is called quality improvement, standard 2, clinical indicators, and standard 3, clinical risk management. Then for clinical performance and effectiveness, we're looking at core standard 4 and 5 around health promotion, preventive activities, clinical management of health issues, and in the GP module, comprehensive care and the qualifications of the clinical team. And then lastly, the safe environment is in GP4, so the GP module standard 4, reducing the risk of infection, 5, the medical practice, and 6, vaccine potency. So what you can see here is that the clinical governance framework is weaved into all areas of the RACGP standards. And when you can speak well to each of those individual standards, criteria, and indicators, all together, it builds your strength as an effective clinical governance organisation and having that framework in mind. If you are curious about the NSQHS standards, these are the ones that apply. They do apply to primary care organisations as well, but more broadly to hospital services and other non-primary care entities. What I would say too is that if you want to elevate your performance in really any of the standards requirements, look at the NSQHS standards, because you'll see a lot of overlap with the RACGP standards, but there are also a number of areas of elevation where it tests and extends out your capability. So if you're kind of going, I'm feeling good around accreditation, tell me more, I want to do more, I'd say go to the NSQHS standards. And again, in the QR code, you're going to get a link to exactly those standards and what that might be all about. So in terms of implementation actions, we first of all, of course, need to ensure that we adhere to all of the mandatory standards of the RACGP standards for general practices. From May 2023, practices can actually choose to be accredited to the NSQHS standards. I'm not aware that there are too many practices that have actually opted to do that. And I guess the reason for that is that they are, in fact, stretch standards. So they are a little beefier than what the RACGP standards are. So not too many are putting their hand up to say, let me have a go at that. But that is certainly an option there. A really important aspect of all of this, of course, is around input from your team. This is not a sole practice management or practice manager activity. This requires your entire team to be thinking about these themes and providing input and context and feedback and perspectives. You also want to really start tapping much more into patient or consumer engagement, input and design. And in primary care, we're really only just starting on that journey. So we know that we do every 3 years a validated patient feedback survey. That's one of the ways in which we currently get some feedback from patients about what they think about our services. But gosh, once every 3 years is not very often, is it? How can we look at co-design and input from patients into more of the everyday stuff that we do? How can they perhaps help with defining what are the important services that we ought to be receiving or ought to be giving? What are the ideas that come from our main consumers of our services? And again, that's putting the patient right at the heart of patient-centered care. You can't really deliver that unless you are having a conversation and communication with them about what's important to them. And of course, that does happen in individual consultations. That's the micro level of patient engagement and tapping in. But from an organizational point of view, it can be very, very difficult to get a sense of how well are we doing there, and what else should we be looking at? Abigail.
Hello, I've just got a question here. So which body conducts the assessment for the NSQHS criteria?
Excuse me. Look, I believe QIP APAL do deliver those services, and there will be a number of other agencies around as well. What I would say is, for the sake of ease, if you are interested in this, firstly, go and have a look at the standards, become familiar with them, and then contact, certainly QIP APAL and ask them about alternative assessment to the NSQHS standards. And they'll be able to tell you a whole lot more about that. That will more likely live within the QIP area than in the APAL area. APAL is very much focused on the RACGP standards. But yeah, tap into them and they'll be able to help you. And certainly from the standards website, you should be able to find all of the accrediting bodies who accredit to those standards. So it'll be more than just QIP, but the exact accrediting bodies, I'm not sure of off the top of my head, other than QIP. I know they certainly do. Were there any other questions to Abigail?
No, that's it for now. Yeah, thank you.
Okay, excellent. Okay, so where did that leave us? Patient consumer input and co-design, roles, responsibilities, assigned and evidence. So this is around, all of your team members being really well aligned to what's important for the business. So that alignment needs to speak to your position descriptions, your orientation and induction, your ongoing training, your ongoing communication and team meetings and feedback from your staff. Credentialing, are we certain that everybody is able and credentialed to deliver what they are delivering? And we're talking about the clinical space here. And then audit, review and regular evaluation, if that wasn't already clear from what I had said before. All right, so we're we've kind of finished up there. I would love to draw the conversation out further if there are other questions here. We do have now that URL link, the top one there, or the QR code that you can go and zap so that you can get access to the basic webinar slides, the RACGP Standards link, the NSQHS Standards for Primary and Community Care, that's what they're called, some other information about e-learning programs, and more information about that national model for the clinical governance framework. The one that you'll definitely want, I think, is that freebie business plan template. You'll be able to download that straight from that link as well. And in addition, I haven't spoken about that, is the RACGP Clinical Governance Toolkit as well. So if that last conversation around clinical governance has kind of really piqued your interest, the RACGP has a fantastic toolkit to help you along the way there as well. So again, I might just pause for a moment and see if there are any questions. Otherwise, we can run into the Northwest Melbourne PHN slides as well.
Lovely. Yeah, so there's no other questions at the moment. but definitely encourage you to pop them in the chat. I'm just going to speak a little bit about the health pathways, the practice management resources we have on health pathways. So still plenty of time to ask any questions you may have, because Rivka will stay on and she's going to drive the slides for me. So maybe just if we can go to the next one, that'd be really helpful. Thank you.
There we go.
May as well actually go. Yeah, that one, perfect. So health pathways. Oh, maybe we'll just cut this out. I can just talk to that one.
Oh, okay. I think it's automatically set.
Oh, all right. Well, we'll let it talk.
Let me go back so that we
sorry
don't miss out on anything. Here we go.
Amazing.
Health Pathways Melbourne is a collaborative online resource developed by Eastern Melbourne and Northwestern Melbourne primary healthcare networks in partnership with healthcare professionals and organisations in the Melbourne region. It provides clinicians with a single website to access a comprehensive collection of locally relevant clinical information and guidelines designed to support general practitioners and other healthcare providers in delivering consistent and evidence-based care to their patients. It covers a wide range of health conditions, procedures, and services, including common illnesses, chronic care, and referrals. The information is presented in a structured and easy to navigate format, making it convenient for healthcare providers to access and utilise during their clinical practice. I encourage you to access this comprehensive Health Pathways platform for all of your healthcare information needs. There is a page for that. Well, we have a page for everything. Here are just a few that may spark your interest. This slide provides a list of relevant related pathways and resources for use, such as legal and ethical, practice incentive programs, infection prevention and control, immunisation and vaccines, and many others. Additionally, you may not be aware that Health Pathways is a tool that can help GPs and nurses with reflective learning that contributes to CPD hours. We have a pathway called Using Health Pathways for CPD, which is formally approved by RACGP and ACRRM. If you don't have access yet to Health Pathways, please log on to melbourne.healthpathways.org.au and click on the register, which will bring up an online form. Alternatively, scan the QR code that's on your screen at the moment. Health Pathways Melbourne is available to general practice teams and other clinicians in the Eastern Melbourne and Northwestern Melbourne primary healthcare network catchments.
Amazing. Well, that pretty much covered everything I was going to say. That's great. I wasn't sure if that was going to work. So yeah, I guess just to add on to that, some of you may have heard about Health Pathways before, and maybe you might have thought it was just I guess a clinical sort of resource. It does also have a lot of resources that support practice management. So I definitely encourage you to have a look. It's available to all general practice staff and teams in the Northwest Melbourne and Eastern Melbourne regions. So with the link that will also be sent with this presentation, please go ahead and access the website and click register if you haven't got an account yet. And if you have any questions about it as well, definitely let me know. So just to conclude the session today, we really thank you for coming, and thank you, Rivka, for such an amazing presentation. I think there's a lot there that we can take away, especially that Excel sheet. I think that'll be really handy for practices in our region.
No problem. So I'll just bring it back to the QR code in case anyone didn't quite have the time to zap that QR code, so we can just sort of sit that for a little bit. And I did put a little message into the chat box to say that I'm happy to hang around for a little bit if anybody's still got any